Hello everyone, I'm Dr. Ali Mirzazadeh, naturopathic doctor, and today I want to talk about one of the most common health concerns I see in my practice, and that is chronic fatigue. Chronic fatigue is beyond just feeling tired. It is about exhaustion that, it takes days, weeks, months, and also affects your daily living. Stay with me so I can show you some of those root causes that you should always consider. Something we should consider that chronic fatigue is not caused by only one thing. It is usually a result of multiple imbalances in your body. And some of those are nutrient deficiency. First, iron, B12, magnesium, and vitamin D are four main nutrients that if they're deficient, you probably feel fatigue, right? The second one is adrenal function, right? If your stress is too high, and what happens is your cortisol hormone, which is a stress hormone, will be imbalanced and put you in a very exhausted state. Third one is a poor sleep quality. And again, that's linked to stress. Some people are stressed at night and they cannot sleep properly. People have sleep apnea, right? Which is most of the time linked to weight gain or obesity or like a being overweight. And last one is hormonal imbalance. That's more accurate if you're going through menopause and you're dealing with symptoms like hot flashes and night sweat that wake you up at night, so which disrupt the sleep quality. Thyroid dysfunction. So thyroid is the main hormone to regulate your metabolism, and if it's off, you feel sluggish and tired. And sometimes the autoimmune disorder related to the hypothyroidism or low functioning thyroid is also a contributing factor. Chronic infection, mono, Lyme, and some hidden gut infection can be also a contributing factor. That's why I always run the gut test or like stool test to find out if there's any inflammation or any microbe residing in your gut. Blood sugar dysregulation. Sometimes people crash in the middle of afternoon, and it's not like, I know some people have a very heavy carbohydrates for the lunch. That's normal to feel a little bit heavy and a little bit like down, but the thing is, if you crash, it's not a good thing. It means the insulin and blood sugar is not talking to each other. And last one is the mitochondrial dysfunction, which I always related to the nutrient deficiency, because lots of those B vitamins are a cofactor for mitochondrial pathway. For the food you eat, how the body can process it. And then if you're nutrient deficient, so mitochondria cannot work to provide the cells with lots of energy. Now we know about the root cause, but how we can find out which one is the main contributing factor? Definitely through doing comprehensive testing. The first and most important one that I do is a comprehensive thyroid panel, including TPO, which is an autoimmune marker. So we have to find out how your thyroid is functioning. I always pay attention to thyroid because most of the time, almost 70% of the time, when I have patients dealing with chronic fatigue, the thyroid is off, and almost 50% of that time, there is some sort of autoimmunity involved. So that's why I always check TPO. Organic acid test, which assess your mitochondrial function. If there is any specific nutrient deficiency beyond whatever I mentioned, like B12 and magnesium, so they also can be a player when it comes to chronic fatigue. Functional stool test. You have to know how is your gut functioning. How is the food that you're eating is being absorbed by your body? Are you getting all the nutrients to give you energy, right? So this is a very valuable test. And finally, if that's needed, I usually do the heavy metal test to see if there is any mold toxicity or candida that's contributing to you being fatigued. Now we know the root cause. We know the tests that can be done. So what are some of those natural strategies that I use as a naturopathic doctor based on the history that I took from you and also based on the blood work result that you have done, right? First one, we have to rebuild those deficient nutrients, especially iron. I usually use liposomal iron, despite whatever usually in the market. Most of the people use a regular iron and they complain about constipation, but I use liposomal iron. It is very specific, and instead of being released in your stomach, it's released in your small intestine. So you're bypassing that, stomach, and reduce the risk of constipation, right? I also use coenzyme Q10, which boosts your energy, gives energy to your mitochondria to function a lot better. Second, I use adrenal gland by adding some adaptogen herb like rhodiola, ashwagandha. Ashwagandha is something I should mention is some people go take ashwagandha, but they overdo it because they heard, oh, ashwagandha is very good, it's a perfect adaptogen. But the thing is, if you take too much adaptogen, especially ashwagandha, it can suppress your thyroid function. So you always should talk to a professional that can guide you in a better direction. Third one, thyroid. If the thyroid is off, which is most of the time is off in my patient, I usually support thyroid by adding cofactors like selenium, zinc, tyrosine amino acids. They're all cofactors to help your thyroid to function better. And most of the time it happens in an integrated fashion. So you usually work with the medical doctors. They usually give you like Synthroid, but it's not enough. I always add some extra nutrients to support your thyroid function. Fourth is the healing the gut. Always the gut is important. So if there's any dysbiosis based on your result, so it means the gut bacteria is not well balanced, so we add probiotic, right? We have some dietary strategies that can help to heal your gut, right? Prioritize sleep. You should make sure follow the sleep hygiene, right? If you are stressed at night, you cannot sleep, there are always the calming herbs like, passion flower, valerian, lemon balm. They are very good herbs that can help you to have a very restful sleep, definitely along with magnesium. And reduce toxic load. If you have lots of toxic load or you have candida, definitely there's a specific protocol to help you to reduce and eliminate those heavy metal toxicity. And of course, at the end of the day, nutrition, movement, and emotional support are the other pillars of your health and well-being.